A couple things you need to remember when collecting a 24-hour urine specimen is that you're going to have to collaborate with all the nursing staff that are taking care of that patient. This includes the CNAs. You need to make sure that all of the collected urine is saved and that none of it is lost, because if any of it is lost, the test will need to be restarted. You're going to want to teach the patient that the first void does not count, and that is to go into the toilet, and they are to completely empty their bladder. At this point, the time will start, and every urine after that will be collected and saved. You're also going to want to talk with the laboratory to find out exactly what this test is for, and find out if they need the specimen on ice or not.
Hi, Eileen.
Hi, Desiree.
Hi. Room 108 needs a 24-hour urine specimen.
Okay.
So go ahead and just don't get rid of it for 24 hours
Okay.
and put it under ice.
Okay. All right. Thank you.
Come in.
Hi, my name's Desiree. I'm a UTIP student nurse. Can you please verify your name and date of birth?
John Moyer, date of birth is November 12th, 1965.
Okay, thank you, Mr. Moyer. The reason why I'm here today is we're going to be doing a 24-hour urine collection. So go ahead, when you need to use the restroom, void the first time into the toilet. And then after that, we'll be collecting your urine in this container for the next 24 hours. So just let the nurse know anytime that you need to use the restroom, okay?
Okay.
Thank you.
I need to go to the bathroom.
Yes? What was that?
I need to go to the bathroom.
Oh, okay. Let me go ahead and get your container. I'll be right back, okay?
Okay, thank you.
This is it. Here you go.
Okay.
Just call me when you're done, okay?
This next clip is going to show you how to perform an intermittent catheterization. The first step is to perform hand hygiene. Then you're going to want to verify the patient's name and date of birth and any allergies, and verify them with his medical record. Then you're going to want to verify that you have orders for the procedure that you're about to do. After explaining the procedure to the patient and making sure that they do not have any questions, you're going to want to go ahead and raise the bed to a level above your waist, since this is a sterile procedure, and also raise the level of the tray table and ensure that it is clean. Put on a pair of clean gloves. Next, you're going to want to lower the side rail and position the patient's legs so that it is easy for you to do the procedure and also comfortable for the patient. Next, you need to do perineal care with warm soap and water. Clean the side furthest from you, then closest to you, then down the center. Be sure to use a clean side of the cloth with each pass. Now comes the tricky part. This is a sterile procedure, so we need to remember all aspects of sterile technique. Now, carefully, you're going to want to open the catheter tray and remove the sterile gloves. Now, very carefully open the sterile gloves and don the gloves, maintaining the sterility of the outside of the gloves. Remember to keep your hands above your waist at all times, and only touch sterile items with your gloves. If you contaminate, stop immediately and obtain a new catheter tray and set of sterile gloves. Now, pull out the first drape and open it, making sure that it stays above waist level. Then place it underneath the patient. After that, Pull out the fenestrated drape or the drape with the hole in it and place the whole of the drape over the client's genitalia. Be sure that the shiny side of the drapes are facing down. Now it's time to finish setting up the catheterization tray. Remove the lid to the specimen container and set it aside facing up. Open the package of swabs and place it inside the tray. Then open the lubrication packet and lubricate the end of the catheter. Now, touching only the inside of the catheterization tray, move it over to the patient. Now, swab the patient's genitalia, remembering that the hand you are using to hold the genitalia is now contaminated. Swab the side away from you, then the side close to you, then the middle. Be sure you do not carry the dirty swab over the catheterization tray. Now it is time to catheterize the patient. Insert the lubricated catheter into the patient's urethra and advance the catheter until urine return is seen. Then advance the catheter an additional 2 inches. Collect the sample in the specimen cup. When it is half to all the way full, pinch the catheter, remove the cup, then drain the remainder of the bladder contents. Next, gently remove the catheter by wrapping it around your hand, and then remove the catheterization tray from between the patient's legs. Throw away your sterile gloves on a fresh pair of clean gloves. Note the characteristics of the sample and label the specimen to be sent to lab, and document it in the chart. Perform perineal care once again. Then make the patient comfortable and cover the patient, and then lower the bed to its lowest position. When becoming familiar with tracheostomy suctioning, you need to remember that tracheostomy suctioning is a sterile procedure. However, after the setup of the tracheostomy set, the only hand that needs to remain sterile is the one touching the catheter, because that's going to be the part that's going into the patient. You're going to need to monitor your patient's respiratory status for the duration of the procedure, and the easiest way to do this would be using a pulse oximeter. You're going to want to make sure that this patient is prepared for the procedure, because this can be very uncomfortable for the patient, and they're going to feel somewhat short of breath, so you want to make sure that they understand what is going to happen. You're also going to want to make sure that you allow good rest periods between suctioning, and then observe your patient's nonverbal cues, because these patients will not be able to talk. One of the easiest ways of doing this is teaching your patient to, if he feels uncomfortable or short of breath, to raise his hand to alert you to stop the procedure. Then you would want to stop the procedure, wait a minute while he catches his breath, and then tell him to cue you again when he's ready to be suctioned for another time. When preparing for a tracheostomy suctioning, you will need some specialized equipment. You need to make sure that the room that the patient is in has wall suctioning, and if they don't, you're going to need to secure portable suctioning, and then you're going to need the suction tubing. You're also going to need a clean collection canister, and then you're going to need the sterile suction catheter of the appropriate size for this patient. You're going to need a set of sterile gloves. Some kits with the suction catheter will include the sterile gloves, some won't, so you're going to need to make sure that you know what you have before you go into the room. You're also going to want to make sure that you have a Chucks pad, some goggles, and a mask, because you may have some projectile sputum if they decide to cough, and so you want to make sure that your face is protected for that. You're going to need a resuscitation or an AMBU bag connected to 100% oxygen, so this way you can hyperoxygenate the patient prior to suctioning. And then you're going to need to have a sputum collection trap if there is a sputum collection ordered. Enter the room and perform hand hygiene. Identify the patient using two identifiers and verify them with his wristband, the chart, and the orders from the doctor for suctioning. Explain the procedure to the patient even if he is unconscious, because this can be very reassuring. Move the bedside table out of the way and then raise the bed to a comfortable working position. Make sure that the patient is in semi to high Fowler's position, because this is the position that will be easiest for them to breathe in. Adjust the suctioning at the wall. Turn the suction to continuous and cover the end of the tubing with your finger. Then adjust to the desired amount of suction for this patient. This step is critical because suction pressure that is set too low will not achieve the desired amount of suction for the patient. Suction pressure that is set too high may cause hypoxemia, atelectasis, and trauma to the upper airway. Charts show suction pressure specific to age, so you would need to look at this chart or facility policy prior to selecting the suction pressure that you're going to be using. In this case, our patient is an adult, so we want to make sure that our suction pressure is set at 100 to 150 millimeters of mercury. Next, don your personal protective equipment, including your goggles and your face mask, and then take the Chucks pad and place it on the patient's chest. Open up the sterile packaging to your sputum trap and your catheter set. Next, open the remainder of the set, being careful not to contaminate the catheter. Then you're going to want to grab the box that the sterile water will go in and open it without contaminating the inside of the box. Now, open the bottle containing the sterile water and pour a little bit out of it into the trash. Then fill up the sterile water box. Once the catheter is covered, you can continue setting up the suction setup with clean technique. Grab the sputum trap and connect it to the catheter, being careful not to touch the catheter itself. Then connect suction tubing to the sputum trap. Now, don a clean glove onto your non-dominant hand, and then proceed to don a sterile glove onto your dominant hand. At this point, it might be helpful to have another nurse or a respiratory tech with you to hyperoxygenate the patient prior to suctioning and between each suction attempt. Next, holding the catheter in your sterile gloved hand, lubricate the tip of the catheter in the sterile water. Then insert the catheter into the tracheostomy. Do not apply suction on the way down. Then, while withdrawing the catheter, apply intermittent suction. Once you feel that the patient has been adequately suctioned and the sputum collection has been collected, then reapply the patient's oxygen tent and clean up the area, making sure that the bed is in the lowest position and the call bell is in reach. Then document the characteristics of the sputum collection and document it in the chart, and then label the specimen and send it to the laboratory.